Well, hello and happy Friday. Thanks for joining us for the Charlotte Maternal and Child Health Work Group Crucial Conversation Series. This is a series that brings folks together to talk about timely and relevant maternal and child health topics. We also use this as an opportunity to highlight some of the great work that's happening in the Charlotte community. So today we are very excited to welcome the PASOs team from Atrium Health. They're going to be talking about their work here in Charlotte, focused on empowering vulnerable communities with very different approaches to reaching our community here. So we're very excited to have them and grateful for you all joining us on this Friday to learn and to ask questions and to just hold space to honor great work that people are doing in our local community. So I'm going to turn things over. So let me stop sharing here. All right. Dr. Tagney, would you like to take over?
Thank you, Dr. Dahl. We are so delighted to be here today with you. We thank everyone for taking time out of your busy schedule to learn more about this new program in Atrium Health. My name is Dr. Tagney Diaz Solis, as Dr. Dahl mentioned, and I serve as one of the community managers for Atrium Health. For the last 3 years, I have focused on serving patients and communities with English as a second language. And today, I am here today with my team who we really focus on a lot about just pretty much serving our communities and those in need. But today we will talk about a specific community, which is our Hispanic Latinos in North Carolina, their challenges, and also this new program called PASOs, Atrium Health, that we were able to integrate to support all vulnerable communities. So I'm here today with Lori and Adriana, who are part of the PASOs Atrium Health team, and they're both community leaders. They provide education to communities to help achieve their well-being. So I will let the team introduce themselves. Lori, I will pass it over to you.
Thank you, Dr. Tagney. Good afternoon, everyone. My name is Lori Tercios. I serve as one of the PASOs resource specialists within the Department of Community Health. And in my role, I focus on serving marginalized communities through the PASOs program, in which it was established nearly 20 years ago at the University of South Carolina. And PASOs was built on a community health worker framework and is designed to support communities through resource sharing, navigating the healthcare system, and provide culturally responsive education, ultimately improving health outcomes and equity. I am also proud to share that I graduated from UNC Charlotte with a bachelor's degree in health system management and psychology. So it's very meaningful for me to be here and speaking to my fellow Niners. And now I'll pass it over to Adriana, which she will introduce herself and share more about the focus of PASOs within Atrium Health.
So good afternoon to everybody. My name is Adriana Rosales. I'm a resource specialist with PASOs. Like Lori stated, it was established 20 years ago. Lori and I are focused on serving children 0 to 5, as well as expecting mothers and adults with chronic conditions here in the Mecklenburg County, as well as Cabarrus County. One of our main focus is providing education to our families and individuals relating to any health condition that they might have, as well as the importance of having a primary care and advocating during their medical appointments. We also provide community resources and connecting them to those resources if they are in need. You can find us during the week at Myers Park office, or we also are attending the mobile units within Atrium Health at the church units. One of them is Nuestra Señora de Guadalupe, and then we also do other events help out in the community as well. Again, thank you for having us today, and I do want to now turn it over to Dr. Diaz Solis.
Wonderful. Thank you, Adriana. So today we have prepared just a very brief presentation for you all just to kind of follow along around what we're talking to, because I'm the visual person as well, and so I really need this in my life. So hopefully this will also guide you a little bit in our conversation today. So this is a little bit of our agenda. I do want to share some data with you all related to our specific topic that we are speaking to today, which is our Hispanic Latino communities. So I'll do the boring side of the data lane. I know our UNC professors here like it, but I can attest to others not liking the data part. Then we'll also share what is the PASOs Atrium Health program and what is it that we are providing and who we support. We'll also be able to share about our community-based partnerships and also our referral system. I'll also dig into a little bit about our program goals and evaluations since the start of PASOs within Atrium Health, which just started this year. It has been a very interesting journey, but we have a lot of work to do. And then we'll share more about our community involvement, the great work that Lori and Adriana do out in the community, and we'll leave some room for questions at the end as well. So just to share some data related to our Hispanic Latino communities within North Carolina, this was taken from our 2020 snapshot. We can see that at this point, we have around 1.3 million Hispanic Latinos within our area. And the darker green, lighter green areas is where we see more of these pockets of these communities. So Fayetteville, the Triad area, the greater Charlotte area are where we see most of our Hispanic Latino communities just residing. And moving to that, I do want to really share about our uninsured rates, and we'll pretty much touch base on it as we progress on the description of PASOs and how that is impacting our Hispanic Latino communities. On the far left, we see our uninsured rate of all races, which is right now it is at 9.2 within North Carolina. So the darker, going from lighter to darker blue, is an increase of those uninsured rates. So North Carolina is right now at 9.2 of uninsured individuals within North Carolina. And our graph on the right is just specific to our Hispanic Latino communities. Meaning that North Carolina, it has a very high rate of uninsured Hispanic Latino individuals. And there's a lot to it, and I will touch just a little bit on it, but there is just so many that evolves around being uninsured and Hispanic Latino within the United States. So just wanted to share some of that. It is thought-provoking. We can certainly discuss as we move forward. I wanted to take a moment just to share this research that I have used within my work, just to kind of review the health inequities and challenges within our communities that are undocumented. More so, these authors related it to our Hispanic patients, but in some efforts, we have also used it with other ethnic groups that are not Hispanic. But pretty much in this research, we found that there was several issues relating to what was creating these barriers for our undocumented patients. And that was one, it was creating a lot of barriers and challenges to access to care, also to social and support services, as well as the immigration piece as it goes, right? We see that right now from this research that 18% of the Latino Hispanic populations are undocumented just in the United States. And that means that they go through all these health inequities and barriers. So meaning that with these barriers, we see a lot of higher emergency room utilization rates because they cannot come and get primary care or proactive care. And also we see that policies such as the signage 287G agreements correlates to a lot of these health barriers. If you haven't seen or heard of this signage, it's pretty much related to what ICE is doing right now. They're able to take people and remove people from locations. They're able to just come up and ask for documentation or legal status. And so this is causing a lot of health barriers specifically for Hispanic Latinos within this research. So the authors pretty much said, here's what we found. Let's think about how we can create some solutions for Hispanic Latino communities within the United States. Let's really focus on access to care, our social support services, and also these immigration services and policies. So hopefully you as community leaders, when you're thinking through all of this, you can take that into consideration as well. And then more research that I found, now moving into the focus about maternal and child health, we have seen that for moms and children that are Hispanic Latino, they have higher rates of poor health outcomes. So on the far left, we see a lot of the data, but we see higher rates of mortality rates within our Hispanic Latino mothers compared to whites. Also postpartum depression, which is almost 40% higher in Latino women. And then we also see that approximately a high rate, 60% of Latina mothers forego care while or during pregnancy, and we see that because of such as the signage of the 287G, or because of cost of care or access to care and all these health inequities that I mentioned before. So it is very concerning to see these numbers, very high numbers of those facing these health barriers and health challenges. And then some of the outcomes that we see based on this data is that we see high rates of prenatal depression and inadequate access to healthcare. We also see Latino infant babies having higher mortality rates. And then the food insecurity and childhood obesity has become very concerning now because we are seeing a very dramatic increase within our very young children. And for my last data lane slide, I do want to just demonstrate about our prenatal care in our Hispanic Latino women, and that's so in the first trimester. So this pretty much is telling us who is receiving care in the first trimester, going from a lighter to a darker blue color, indicating the darker blue color, those that are actually going into receiving all these care, and then based upon, of course, ethnic groups and races. So if you see here, we see that our Hispanic Latina moms are at a 60.2 number, which is the lowest number of receiving prenatal care within that first trimester, followed by our Blacks and non-Hispanic moms as well. So these two groups are in the marginalized groups. I think you all know this, but because of these health barriers and health inequities that we're seeing, moms are just not receiving the care they need within this first trimester. So that was just a little thought and point about our data that we're seeing within the United States and also North Carolina related to our Hispanic Latinos, maternal and child care, and some of the impacts that we see. So with that, we in Atrium Health were able to bring in PASOs from the University of South Carolina to Atrium Health to support some of these marginalized groups within Mecklenburg and Cabarrus County. So I will pass it over to Lori to just share a little bit about PASOs within Atrium Health.
Thank you. Yeah, so keeping this data in mind, these are goals, focus and outreach that we have initiated. And then also with the support of the team from like South Carolina. Our focus is mainly in Mecklenburg and Cabarrus County residents. As of now, hopefully we're hoping to expand in the future. And with that is childhood development 0 to 5 years old, pregnant women, and providing culture appropriate health education, community connection. And then we also included chronic disease prevention and just giving education in regards to chronic disease such as diabetes, connecting patients if they need resources for cancer, and then also just in general serve underrepresented patients. So we are not excluding anyone. It's anybody in the community that needs us. And then providing resource navigation. That's in regards to our goals. Our focus. And then our goals is to spread awareness of needs in our community, create a sustainable process for patients to feel empowered. And then in that providing holistic support, not only just in their health, but like their mind, their spirit, and anything that they would probably want us to, give those resources or have somebody else that can be there with them throughout the process. Increase their health knowledge among participants. I think sometimes it's difficult to navigate through the healthcare system, so we're there to support and overall improve health outcomes while we are identifying some social determinants of health and their needs. And as outreach, we have been hosting and supporting community health fairs, which we're going to discuss further down in our presentation, and then creating partnerships with internal and external organizations. Internal is within Atrium Health. There are different departments that we have been able to communicate and support each other. And external, we have also a list that we also going to discuss further down this presentation. As of right now, since our program just initiated, we have presence in mobile unit at our Lady of Guadalupe Church and the Myers Park Pediatric Clinic. And then for high risk patients, we do home visits, which we also have been incorporating into our program. And then we're going to speak more about the partnerships, and I'll hand that over to my teammate, Adriana.
Thank you, Lori. Yes. So we're really grateful for our partners because they help us achieve our goals and also our outreach. Some of the main or our closest partners are Nourish Up. With them, participants are able to receive food boxes, diapers, and it is really convenient because everything, the referrals can be submitted online. One of the other ones is La Voz de la Esperanza. That is a church that we attend to in like certain times of the month with their events. They provide food, diapers, and also spiritual and prayer as well for whoever needs it at that point. And they don't require referrals. They have a walk-in availability. We also partner up with Beds for Kids, that is for patients or participants that need furniture. There is a cost associated with it, which is $60 for beds and $100 for a full home of furniture for the whole house, which is really affordable for most of our participants. And we also partner up with Charlotte Bilingual Preschool. They not only provide affordable or a low cost education for preschool students, but they also provide clothing, baby essentials every Friday at no cost, and they don't have to be they don't have to be members, or they don't have to be part of the school. We do have an extensive list of 34 partners that range from food, clothing, also organizations within the community that help other newcomers assimilate and also help people with housing. And we're really glad to be partnered up with them because it helps with our mission. Now we're moving on to the next part, which is building our building our partnerships. We build partnerships with any healthcare a social service, community service, and faith provider that aligns with our vision to serve marginalized communities. Our strategy, we assess the potential partners' cultural response on family health, early childhood, and chronic illness, as well as services or resources that they offer, and how it could impact our participants' outcome or livelihood. Our referral process is usually can be conducted for our participants, our PASO participants, and organizations can refer participants to PASOs via our resource hub or also our interest form, which and you can use our QR code, and if for some reason it's not working, you can also use our link. So I will pass this over to my teammate.
Awesome. Thank you, Adriana. So a little bit more about PASOs within Atrium Health since our inception on August 8th. We really just wanted to share a couple of numbers with you and of what's been happening, right? So as of today, or as of actually yesterday when I pulled this data, we had 42 unique patients that are still active, although there have been several others that have been already completed, so I did not add into this number. And that means that we had 42 patients coming from our Myers Park Pediatric Clinic, also our primary care mobile unit over at La Voz de la Esperanza, and also for some community referrals that we have been receiving. And on this graph, you can see on the right, we have had so far 13 community referrals, which is also combined with this 42 number of our unique patients. So a lot of our referrals are coming from the community, and we really do appreciate that. So now I will pass it over to Lori to discuss some of our community involvement.
Thank you. Yes, with community involvement, we already spoke about our close partnerships and where we're housed in the moment. The main two that we can speak of is the mobile unit at Our Lady of Guadalupe, which is there every Monday from 8:30 to 3:30, and they provide just support and medical support and primary care for individuals. And we're there to also provide support for that partners. And we have served approximately 75 to 120 patients since August. So we have seen a rate to go up. And I know Tagni shares some of the referrals that we received, but then also sometimes it's not referrals directly from providers. It's from us being in the community and speaking to them and following up with them. And the second one is La Voz de la Esperanza. It's a church here in Charlotte, and they have a monthly event, or they host a monthly event supporting mothers with resource and community. So they are already providing that spiritual care and connection, and also providing resources, but we're also there to provide information, education, prenatal vitamins, and then enrolling them if they need additional support within the PASOs program. So far in the past, we have attended 5 events since July 2025 to November, which I was there yesterday. So definitely that number that Tagni pulled in that graph has gone up. And we have served approximately 125 to 250 patients or participants. So it's just, this demonstrates just some work that we have done within the community. And then there has been other community events that we have supported as well. So we just want to share a little bit of what we have been doing and the numbers. And then these are more specific community events that we have attended. So Adriana is going to speak more in regards to that.
Thank you, Lori. Yes, so we just highlighted some of them. We have attended quite a few, but one of them was the Save Kids Good Neighborhood event. It was an event organized to provide car seats for children that needed them. It was a really good event. We had, even though it was really bad weather, we had 76 children that were assisted and 36 car seats that were actually provided. We were there helping with the Spanish speaking patients that were coming in, helping, translate and also helping them explain and understand the safety of a car seat for their children and the appropriate car seat as well. We also went to a dairy farm clinic event in Iredell County, which Dr. Diaz was really nice in helping us inviting us to join with her. The other highlighted one that I wanted to talk to you guys about is the health fair that was hosted by the faith health community. Atrium Health participated along with many other partners within the community just to help families that are part of Our Lady of Guadalupe Church. It was during a Sunday. They are pretty much the only or the main Hispanic or Spanish speaking Catholic church within Charlotte. So they do have a massive amount of faith individuals that come in. So that day, approximately 5,000 participants attended, and we were fortunate enough to be in contact with a lot of them as well to try to see if we could be of any service to them. I do also want to mention that we recently had a caminata, which is a walk in the park. We had a lot of fun. It was for our diabetic, Dr. Diaz diabetic team participants, and it was really great. Now I do want to pass it over to Laudy to give some information or a story about one of our cases.
Thank you. So we already spoke about the data, the things that we do. We wanted to also include some information of the family impact that we have done throughout this few months. This is our pilot year, so it's an ongoing effort. And there are so many that we could pull from, but this is one that we just felt special to. And also if Dr. Diaz and my teammate Adriana wants to share, that would be amazing as well. But for this specific one, it was a mother that we met at one of the outreach events at La Voz de la Esperanza. And whenever we met with her, she said, okay, we're here because we need diapers and food, which they did receive some of them that day. And we provided some resources. We have a list that they're able to, pull from or be connected with. And I said, okay, so Adriana and I were there. What else can we support you? We spoke to them about the PASOs program and we follow up with them. And she was a teenage mother and she had just had her baby, a 3-month-old, and just lacking parental figure, living with her unemployed mother. We're not aware of the situation until we became acquaintance with her story and follow up with them. The family faced several difficulties, including shortage of clothing, diapers, food, and transportation. So it was not only food and diapers. The PASOS team, Adriana and I, have been providing culture-sensitive support by connecting the family with local resources for essential items and advising them on how they can have some transportation options and enroll them in the program, providing vital supplies, build that relationship with them so they can trust us as somebody in the community. And we also did some several referrals that would support them as well, because this is a community effort. It's not only us, there's other partners that can also support them and even provide even more specific support. For example, Despierta Bonita Mama program, they focus on teenage moms that are still in school. The Charlotte Bilingual Preschool, they provided clothes and diapers and baby essentials. The Bowl, which provides food like fresh food every week, and information in regards to WIC, since they were not connected yet, receive continuous support for transportation, food, and household items. We're still working with this family. As of next week, we are going to do an in-home visit because the mom, she's in high school, and the grandma, she just lost her employment, her job. And so they have been facing so many unfortunately, so many things or harsh circumstances that they are able to like share with us and trust us, and then we want to be that hand that can support them and provide support as much as we can and connecting them with information and for them to feel more confident. And then we move on into just overall PASOs in North Carolina, and I'll pass it over to Dr. Diaz.
All right. Well, topping that good story is going to be hard, but I do want to mention a little bit about the vision of PASOS in Atrium Health and in North Carolina. So this is pretty much the first time that we've had PASOS in North Carolina and even in Atrium Health. So starting 2028, our main focus after really gathering all this data and program evaluation and impact and supporting our communities, we do want to seek further expansion of this community health worker framework, supporting with resource sharing, navigation, and also health education. So by 2028, we do want to expand into other areas or regions where we have a high pocket of Hispanic Latino communities, with that including our Union County, Rowan County, and also in the Triad area as well, which is following the footsteps of Atrium Health. We do certainly want to serve in more clinics and hospitals. As you heard right now, we're just in one clinic, supporting our community mobile clinics as well. But by 2028, we want to ensure that we are in at least 10 new locations and facilities. And we also want to cover other focus areas. Right now, you heard about the maternal and child health and the chronic conditions and diseases, but we do want to make sure that we are also covering more preactive focuses such as disease prevention and also disease prevention for cardiometabolic conditions, which is a very big concern for us in the United States. So I will pass it over to Adriana.
Thank you, Dr. Diaz-Solis. So I have some pictures of all of us and how you can contact us. You can email us. So I have Lori right there with her email, and myself, and also Dr. Diaz-Solis. And like we said earlier, also, you can also reach us through the hub or our QR code.
Fantastic, y'all. Thank you so much. We have some questions in the chat. So let's start with Megan that had asked a question. Is the mobile primary care unit free or low cost? And is a referral or appointment required?
Sorry.
You can go, that's fine.
Okay, the mobile primary care unit is within Atrium Health, and they have several ones, not only at Our Lady of Guadalupe, but we do have a calendar that we can put on the chat as well. They do need appointments, so we do have a number that they can call and make appointments. Is it free or low cost? If the patient needs assistance, Atrium Health does have a financial assistant program that they can apply, and they can receive care at no cost or at very low cost.
Thank you.
And then we have a second question in the chat. What kind of specific support are you able to provide at these events?
Well, I think it's also a cultural a cultural support. Sometimes it's not something physical that the participant might need, but more of reassurance or support by telling them, I might not know or I might not have the resources right now, but I will find out for you or I will connect you to the right person and you can contact me this way or contact me through, you know, email, text message, whichever they prefer. And also, just speaking in their language, which makes it easier.
Thank you. We have another question. I may have missed this, but how does a person get referred to your services?
So I'm so sorry. I can add some, and then Adriana, if I'm forgetting, you can include them. So we do have several options. If they're already connected with a primary care provider, they can do a directly referral through our Epic system within Atrium Health system, and then we receive them. The second option, the second option would be through the community resource hub that anybody can go in and just put their information. And then other ways is in the outreach events that we have attended, they can come speak to us and we can enroll them right there and then. Or we do also have a QR code that they can have access to. And then we're trying to, expand our program within Mecklenburg and Quebec. So once we make partnerships with different organizations, we provide them that information as well.
Great. We have another question. Can you share a little bit more about any ongoing strategies to develop and share learning materials or resource guides that can be distributed in this community?
I can take that one for the team. So Atrium Health currently has a Healthy People, Healthy Carolinas coalition going on, which we have in different counties as well. And this specific coalition is one led by community leaders. And one of their subcommittees is called the Information Access and Learning Committee. And so this committee is currently working on specific ways that marginalized communities can access, understand, and gather these learning materials. While it's still in the planning phases and implementation phases, we are trying to collect data, do research based on specific marginalized groups and also those with a higher sociodemographic or education level as well. But our goal is for 2028 to have a good strategy or tool where we can have all these resource guides available and everyone is able to access them. So this is an ongoing strategy. We don't have it just yet, but we will get there.
And it sounds like y'all have just hit the ground running since August. So really excited to see how this program will go. A question about the fact that this was a program that started in South Carolina that you all kind of brought to this space here. Has there been any significant deviations from the original kind of implementation of this program or anything that has had to be adjusted to fit the Latina population here that you're serving?
Absolutely. Thank you, Dr. Dahl, for that great question. And really, University of South Carolina implemented this framework because of the needs and barriers that the community was facing. So the community health worker framework was pretty much the best strategy that they had, which has continuously been amazing, right, in the community. That's why they've had it for 20 years, provided so much research. With us in Atrium Health, we already have a lot of support services. We have care management. We have a large community health worker department only focusing on SDOH needs. But with PASOs, bringing it to Atrium Health, we are bringing in that cultural notion. And we're also bringing in the education piece related to community health. Community health workers do provide a lot of education in the community, but Now in this level, we're taking it up a notch, right? We are ensuring that our one-on-ones are having that community, that education piece to it, other than providing resource sharing, resource navigation. But the other part of the good side that PASOS brings is the advocacy piece. We want to ensure that communities, we are building capacity within communities so that they are becoming these champions, and then also educating others on what questions to ask for in their primary care visit, what questions to ask about their child or their maternal appointment, and speaking out, because in the Hispanic Latino communities, we have seen that they are quiet during their appointments, they don't ask questions. The physician, clinician is pretty much the god at that point, and they don't want to address this like a concern or conflict. So PASOS has really taught us that this is more of a cultural benefit for our patients. And really, we want to ensure that we are demonstrating that and we are supporting communities in the way that it should be.
Thank you. In terms of this community engagement and the outreach, right now, it's a pretty challenging time for a lot of our Hispanic and Latino communities. And so I'm curious if you have implemented any strategies to really build trust through that word of mouth, because it sounds like you're getting a lot of referral in that way. And so what do you all hold as values in the work that you do that might be translating to building that community and that trust for others to come and receive services?
I feel like one of the things that we've done is made connections with already established either community health workers or faith workers. Um, they are the ones that are kind of opening doors for us when it comes to trust within the community.
Yes, well said, Adriana. I agree. It's leveraging those partnerships that we already have, right? And those that are community leaders and trusted in the community. Although we might look the same and speak the same language, we might not be trusted. However, if we continue to show up, we continue to hear them and actively listen to their needs, and then bring that back to our leadership and let's say, can we bring this? Can we, this is something that was asked by our community. They can see that we are truly trying to help them and truly trying to listen to them. So that's really helped us along the way.
Thank you all. Do we have any other questions from the folks on the call? All right, so I'm going to share a few slides to wrap us up today.